Interesting.
I know. Well, we had that panel with 6 people, and then all of their people came. And I'm like, this is getting crowded. You know, when their people, the people for the people who were speaking came? Are you gonna? Were you walking enough?
Ready to go? Good afternoon. Thank you all for joining me here. Before I get into my prepared remarks for this evening, I want to make a clarification, a correction for a misspeak, I guess, that I had. I guess that's how I'd classify it. In a previous press conference, I implied, or at least left the impression to some folks, that I was blaming our current Nevada legislature for the systems issues experienced by Dieter in processing the incredible flood of unemployment claims that we've got. That was certainly not my intention. The truth is that for decades our state has had to make tough choices in funding state services. That challenge has caught up with us in these unprecedented times, confronting an overwhelming demand for service. But this is a long-term structural challenge. It is not the fault of our legislators, who are working very hard for Nevadans every day. So I want to apologize to the legislators of both parties if I gave that impression. Good evening. Thank you for being here with us this evening. Tonight, I am pleased to present to Nevadans our state-specific plan for reopening. A copy of the full plan can be found online at nvhealthresponse.nv.gov. Nevada United, Roadmap to Recovery, is designed to build a path forward and safely restart Nevada's economy. As the governor of this great state, a former locally elected official, and most importantly, as a father and as a husband, I share our collective goal of seeing our communities get back to business. We have taken great steps together as a state to keep Nevadans safe against COVID-19. And while we continue to do that, we must now chart a responsible path forward that will get Nevadans back to work under a new normal. This roadmap outlines a coordinated state-specific plan to address the COVID-19 public health and economic crisis. The core guiding principle is that our efforts should be federally supported, state-managed, and locally executed. I am confident that if leaders and stakeholders throughout Nevada work together to accomplish our shared goals, anything is possible, even in the most trying of times. We will do this as quickly and safely as we possibly can with a gradual, phased-in approach. When I first became your governor, I promised to put Nevada's families first. It breaks my heart to see Nevada families suffering because of COVID-19. But this roadmap helps me put the state and our families back on track. I've taken immense pride throughout this crisis whenever I see Nevadans helping Nevadans, and you should too. It's our resiliency and spirit that makes us great. We are battle-born, and right now we are being tested in this battle against COVID-19. Together, we will be Nevada united and battle-proven. The reality is this: no single elected official, business, government entity, or individual Nevadan can accomplish this task alone. All of us have a role to play when it comes to ensuring the Silver State recovers and comes back stronger than ever, but it will require common sense and personal responsibility, and all of us play an important role in this roadmap. In addition to the principle of being federally supported, state-managed, and locally executed, there are a few other guiding principles in this roadmap that should drive our decision-making that I wanted to highlight for Nevadans. First, the timetable for a strong recovery will be determined by the virus and the behavior of Nevadans. The reopening of Nevada will happen the same way the state was closed down, in phases, and following the guidance of the Centers for Disease Control, the CDC, and our medical experts. Secondly, we must all work to ensure our response efforts encompass access for all at-risk populations, including older individuals, lower-income Nevadans, tribal communities, racial and ethnic minorities, vulnerable populations, and our veterans. Finally, the state's management of the recovery and reopening process must remain flexible at all times, with ongoing monitoring of local and statewide data reporting and analysis. The state must maintain the ability to track warning signs in order to prevent an avoidable spread of the virus through an aggressive intervention. Look, I know this can be overwhelming. All this talk about infections, testing, and ventilators over the past 2 months is not something that any of us are used to. I know how most Nevadans are feeling right now. I really do. The fog feels like it's clearing away, and many of you are probably asking why you're sitting at home. Why are schools closed? Why can't you grab a beer with your buddies or go to a game with your family? I get it. I really do. Because we've done such a good job, the threat of COVID-19 feels distant and abstract. To many, it might not feel as scary anymore. But I have the unfortunate responsibility to remind all of us that the threat remains real. Just a month ago, models were predicting high peaks of hospitalization and overloading of our healthcare system, and death tolls potentially in the tens of thousands. We can't forget that. After all, there is still no vaccine for COVID-19 at the present time. This means that in Nevada, the only reason the number of confirmed cases and deaths is not significantly higher is due to the implementation of strong social distancing measures, which is why the criteria for reopening I announced last week are so critical to our future success. I want to give a refresher on the criteria for reopening and a status update as of today. First, Consistent and sustainable downward trajectory of COVID-19 cases and a decrease in the trend of COVID-19 hospitalizations over a 14-day period. As for percentage of people testing positive, we reached what appears to be a peak on April 24th, and that rate has been declining since that time. We are watching this trend very carefully. Confirmed COVID hospitalizations are following an overall decrease, but we must evaluate this data carefully to be sure that the decreasing trend is sustained if more suspected cases are confirmed. We will be watching this trend closely. Number two, ensure that our healthcare system is out of crisis mode and able to handle potential new surges in patients, along with non-COVID related services. The hospital system is continuing to indicate an available immediate surge capacity for all-cause or COVID-19 patient influxes. This is a good sign. Number three, expanded ability for healthcare providers to administer tests for symptomatic patients and sufficient laboratory testing capacity to process COVID-19 testing samples. This is where we have some really good news. Due to the hard work of the public health authorities, our incredible Nevada Division of Emergency Management, the Nevada National Guard, local leaders, and more, Nevada now has the capacity to test all symptomatic individuals at this time under the testing guidelines issued by this state. We have met the criteria. We know long-term we will need more testing. We'll be building our capacity to test asymptomatic Nevadans as well, which is one of the primary goals of our response efforts. Number four, sufficient public health workforce capacity in local and state departments to conduct case contact tracing. These efforts continue to ramp up to scale, and I'm so proud of the progress that we have made. We'll be working with the counties and public health authorities to address the immediate and expanded workforce needs for case interview and contact tracing. We feel very positive and are exploring many innovative ways to expand this workforce and be ready for phase one. Number five, sustained ability to protect vulnerable populations. Outbreaks minimized in special settings like health facilities and nursing homes. This is highly qualitative criteria and one we take seriously. We must have and remain safe during this process. Here is what we won't be able to open in phase one. Bars and nightclubs will remain closed, as will malls, large sporting events, large in-person places of worship, and concerts. I know we are all looking forward to these opening up, but due to the density and risk, we will be unable to do so in phase one. And when it comes to our biggest industry, all final decisions on how gaming establishments reopen in the state of Nevada will be determined by the Nevada Gaming Control Board. They will be working closely with local health authorities and medical experts to monitor progress. Here's what I can tell you today. Gaming will not be opening at the start of phase one. We will stay in phase one for a minimum of 2 to 3 weeks, the recommended time frame necessary to evaluate trends in cases and hospitalizations as we relax restrictions. Some of this may sound familiar to those of you keeping track of our plans in fellow states who are navigating the reopening process just like us. But there's something uniquely Nevada about our plan that I want to share with you. And it goes back to our guiding principle of ensuring our roadmap is state managed and locally executed. Up to this point, the state has directed the response efforts for COVID-19 and determined which businesses can remain open under strict conditions and which businesses must close to prevent the spread. These were difficult decisions. I had to make these under unimaginable emergency situations. But in our effort to begin transitioning into more familiar territory, my goal with our state-specific plan is to return to the Nevada style of collective and collaborative governance and decision-making that sets us apart. We may not always agree, but we are one of the few places where political disagreements will not prevent us from working together for the good of our state. I know this in my heart to be true. We don't always have to agree, but if you love Nevada, we're going to do this together. That's why, in order to help us navigate Phase 1 and plan for future phases, we're going to partner with our locally elected officials at the county level who are the experts in their communities. State support and oversight through its existing regulatory and licensing structures will continue, but responsible county governments with their knowledge of unique communities and their existing local licensing and regulatory structures are in the best position to execute the gradual reopening of the businesses and public life of their local residents. Under this state-managed, locally executed roadmap, the state will continue to issue statewide standards and restrictions for each phase under which individuals and businesses must operate that are based on the social distancing requirements necessary to ensure that Nevada's public health care system is able to respond to any surge from COVID-19. Only now, in an effort for Nevada to start returning to the normal structure of government decision-making, the County Commission will have an increasing responsibility for determining the manner in which businesses within its jurisdiction can open and operate in. The main requirement is that county guidance and restrictions must meet or exceed the standards set forth by the state in this new directive. I will be issuing prior to entering into Phase 1. It would be a disservice to the residents and businesses in our state to pretend like Esmeralda County is the same as Nye County, or that Clark is the same as Elko. They're not, and that's okay. That's why our response efforts should reflect our regional differences while still operating under our shared statewide goal of keeping Nevadans safe and restarting our economy. And in order to ensure a strong state and local government partnership through each phase, I'm happy to announce the formation of the Local Empowerment Advisory Panel, or LEAP, a group of Nevada stakeholders who will serve as resource for counties as they work through the necessary requirements to reopen and share best practices and guidelines for local communities. The LEAP will also be working directly with my office to inform all future directives governing business and public life throughout each phase of this roadmap to recovery. I am pleased to have Eureka County Commission Chair J.J. Gokachia represent our rural counties. They will be joined by representatives from the Nevada Association of Counties, better known as NACO, the Governor's Office of Economic Development, in addition to the Director of Nevada Department of Business Industry. The LEAP will consult with business and industry representatives, work and labor organizations, public health authorities, the Nevada Hospital Association, local government representatives, state legislators, and other stakeholders as needed to help the state and our counties navigate each of the reopening phases. It's through your leadership that we will make sure that the state managed and locally executed roadmap is customated for every corner of Nevada, that the whole of our state remains united and healthy. I come from the counties. I am the only governor in the United States who most recently served as a county commissioner before becoming governor. I get it. I know where you're at. I uniquely understand that counties know how to get the work done. They've known what is best for their residents and what their business and residents need and how they operate. I have not and will not forget that. And now as your governor, I maintain the responsibility for the health and safety of all Nevadans. And I know that it will hurt all Nevadans if they know what's best in their specific areas, and I'm going to take a lot of direction from them.
Not a 6-phase plan, a 12-phase plan. How many phases? How many phases are we talking? I don't know if my microphone.
Right now, the microphone's not working. Right now, I'm on Phase 1. There's going to be a Phase 2. I don't know how many phases there'll be along the way. This is a work in progress, and we'll keep you as informed as we possibly can. It will determine if the LEAP group determines that some things should be in Phase 2 and others in Phase 3, or they might put them all in Phase 2. That'll kind of depend on what their input is.
Should be unmuted.
Okay, Michael, I gotta interrupt you. I'm sorry. Can you please speak into your handset because I'm having trouble hearing you on the speakerphone? Yeah, it's a little bit. Go ahead.
Every day, state officials are being provided a spreadsheet from the Nevada Hospital Association containing a hospital patients they're treating, their stock with N95 face masks, and whether they're facing staffing issues. You all know those those. Our newspapers requested copies of these spreadsheets multiple times, only to be told by state agencies it would take 8 to 10 weeks to produce them, if they are produced at all. And then at a hospital association that is unwilling to share their reports with us directly. Governor, earlier month, we told them that they're having difficulty during the outbreak. Is the state honoring their commitment? Is it going to take more than 2 months to produce these reports?
Well, I don't know who told you it's going to take 2 months to produce a report. Understand that we are operating in real time. You know, we're providing as much information as we possibly can to the media with freedom of information requests. We are inundated with requests from different media outlets. Everybody's asking for different things. I'm short-staffed. We don't have the largest staff in the world. We will get them to you in as timely a manner as possible, and I will ask about your request that somebody told you 8 weeks.
Thank you, Governor. You mentioned that efforts are currently underway to hire more staff for contact tracing. However, a recent NPR investigation found that Nevada only has 2.5 personnel who are capable of that per 100,000 residents. However, experts suggest having around 30 contact tracers per 100,000 residents. So can you provide any more detail about the efforts to find more of those personnel and get them trained and ready?
Sure. We fully understand that what we currently have for contact tracing is nowhere near enough. We've never had a pandemic like this that required so much contact tracing. We are working with some of our business industry partners who have offered up some of their employees that are currently being paid, but these business properties are not open, call center type employees to train and help them get onto the contact tracing. For people that don't understand, if you get somebody with a positive, you have to contact, you ask them who their immediate contacts that they had contact with, and you have to call those people individually. And it takes some time. So we're expanding that as quickly as possible. That's going to be one of the determining factors that LEAP is going to use in order to determine how quickly we can move into phase 1 so that every county has a sufficient number of tracers.
And do you have a benchmark number of contact tracers that will determine you can move to the next phase?
No, I don't have a benchmark number because the number that you need in a low area like White Pine that might not have many cases isn't going to need anywhere near the same ratio as somebody in Clark that has a bigger ratio. So the county has to be comfortable that they have enough, and that when they submit that to us, we'll have to have my department buy off on the fact, my medical advisory team, that that's enough.
Thank you.
Certainly.
Thank you. We'll go back to the phone line. Jacqueline, Schultz 5, your line should be unmuted, and if we have trouble hearing you, I'll repeat the question for the governor.
Governor, thank you. We are aware, as you mentioned, what definitely will be closed from bars, nightclubs, malls, concerts, etc. Do you have any further clarification what non-essential businesses or services can open, such as contact services from any hair salon and massage services, anything service-oriented that involves contact? Is that even an option in this one?
The question was about some of the non-essential businesses and whether they'll be able to open in phase 1. Some of the examples were massage parlors, salons. So the question is related to whether they'll be able to open.
Okay, the determining factor on what will open in phase 1. Well, I specified that gaming would not open at the beginning of phase 1. Bars will not be in the beginning of phase 1. It'll determine what the county comes up with, the different counties in terms of handling that. Director Brown is here with us this evening. They're taking restrictions. I'm counting on the Restaurant Association will hopefully provide us with some guidance, what they feel is an appropriate occupancy level and safe distancing things. The same thing with the Cosmetology Board is going to have, it's not going to be business as normal. There's going to be a new normal in place here, and the experts in that particular field, we can't make these decisions by ourselves. I'm relying on the Cosmetology Board to help us with the cosmetology industry. I'm relying on the Restaurant Association to help us with restaurants. And with our partners in the various counties, hopefully we'll be able to find a happy medium where we can address the safety of Nevadans as well as the phasing in of our business structure again, our economy.
Thank you. We'll come back to questions in the room.
Governor, the current moratorium we have on evictions.
I don't have an immediate timeline on the current order of evictions. I'm dealing with this plan right now, and I'd have to work with the Attorney General in terms of what feedback he's had. He's been handling the eviction situation in terms of people coming forward, but I don't have any change on the eviction order as we stand here today.
Do you have any sense of what you're looking for? Is it going to be in a specific phase or at some other point?
Well, this is another thing that is going to be important for the counties. The evictions that are necessary in Esmeralda are not the same as the eviction problems that we're facing in Washoe or Clark, our two biggest counties. And I'll rely on those county commissioners to give us the feedback in terms of what they're facing in terms of the eviction situation and how best to handle it in their counties.
Thank you. We'll go back to the phone line. Thank you. We'll go back to the phone line. Noah Glick of the Mountain West News Bureau. You should be all set to ask your question.
Okay, so we'll go to Michelle Price.
Okay, so we'll go to Michelle Price of the Associated Press, and if Noah comes back on, we'll try to circle back around.
Can you clarify what you mean by the beginning of phase one, or the bar not open till phase one? Casino open at the beginning of phase one. Does that mean they could open by November, by the end of May? It sounded like earlier this week, casinos weren't going to be opening till phase 3 or 4.
Well, I've kind of changed the phases, and I might have gotten ahead of myself in saying there's 4 phases. There might be 3 phases, there might be more phases, depending on how the different counties and businesses adapt and how much we move forward at a time. What I'm saying is that in the beginning of phase 1, which I hope will come May 15th or sooner, depending on the continuing trajectory of our data that we're tracking, our analysis, and the cooperation and work that we're getting from our counties, and they've already gone to work, and I thank them tremendously for that. We'll have to determine where gaming would fit in there. Now, I know that I've had regular discussions with the gaming industry and with our labor leaders in the gaming industry. Chair Sandra Douglas Morgan is in constant contact with them. They're providing plans for their opening on individual bases. These are confidential plans that aren't shared with each other, and she will develop a plan that will work for gaming, and I'm going to leave it up to her and the statistics to determine how quickly that can be.
Thank you. We'll come back to questions in the room here.
Hi. So earlier in the week, you said Nevada is going to join the Western States Pact. What will that look like? Is that going to impact like Nevada's plans for reopening?
No, it's well, we're taking a lot of advice from our partners. That there's 5 of us in that pact now. We're exchanging best practices. I speak with those governors. I've already spoken to those governors before we joined the pact. What you've got to understand is a lot of the tourists we have coming here to Nevada are citizens of those 5 states, or 4 states in addition to us. They're our customers, so it's important that we collaborate with them, we communicate with them, we share our best practices. And we'll continue to do that. That's the idea behind the pact. It's not to coordinate some massive effort. We're not becoming one. It's more for sharing of information and best practices.
And with today, you're saying counties have different problems, have different things. Do you see like one county opening before another county, one county opening phase 1 before other counties, or is it
No,
going to be
all counties, all counties will open phase 1 at the same time. But it will be incumbent upon them to provide the information that we're asking for. If one county doesn't do it, nobody's going to open in phase 1. So hopefully every county is going to cooperate, provide us with that information so that we're comfortable protecting the health and well-being of all our citizens and still slowly phasing in our businesses.
Thank you.
Sure.
Thank you. We'll go back to the phone line. Ben Stillman, if you're on the line, it's your turn for your question.
Hi. People have talked about outdoor recreation obviously being important, but also some things that happen close to home. Do you consider people going from Reno's Parks to the Tahoe Basin staying close to home? Or would you expect that people in Reno and Sparks stay in Reno and Sparks?
Well, I guess it would kind of depend why people in Reno and Sparks are going to the Tahoe Basin. If they're going there because they want to go out for a ride or they want to go for a walk, as long as they practice social distancing, that's okay. But when they get further away from home, it's just the most important thing is that they practice social distancing and not get in groups of 10 or more.
Excellent, thank you.
Jefferson Tyler from 2 News. My question for you is, a lot of restaurants have adapted to the restrictions. Now you're changing it to curbside for all retail right now. What about services like hairstylists and stuff like that? Would you be open to allowing them to do curbside as well, or in-home haircuts as previously, as you said you can't do right now?
Okay, well, for salons, hairstylists, manicurists, eyebrows, whatever that might be, they cannot do in-home per their licenses. They cannot do in-home. I don't know how you do a haircut on the curb. I mean, I don't know how that would work. I'm relying on the cosmetology board with Director Brown to come up with a proposal, how to do this safely. Different states have done it different ways. This isn't, this is a best practice, whatever they can come up with. I want to open up all of these businesses, but it's not business as normal. You can no longer have 24 people in a 500 square foot salon getting their hair cut or their nails done. It's simply not going to work. So they have to come up with a plan to move forward in a safe and reasonable manner, and that's what we're relying on.
So if they wanted to put a chair out there and say, hey, sit in the chair out, you're saying no, right?
No, they're not going to do that on the sidewalk, if that's what you're asking me. Yeah, thank you.
Thank you. We'll go back to the phone line. Joe Bartel, KTNV. You should be unmuted and be able to ask the governor your question.
Hello, Governor. My question is about hospitality workers and service industry workers who have told us that they are concerned about their safety even as businesses reopen and services can resume. They're concerned about their individual safety. How do you reconcile those fears as businesses reopen, and what recourse those individual employees have about their safety?
Well, certainly, no one is being forced to go back to work or to open their business as we move forward. This would be incumbent upon the business to decide or the individual to decide. I can tell you that good business practices would stipulate or would require that they have hygiene procedures in place, that the workers feel safe, that they have PPE, that they have distancing, that has been clean. I know that the resort operators have made that a primary focus of theirs as they've talked about their plans to open up or to move forward, that they have a system in place so that their employees feel safe, their customers feel safe, and they can eliminate the spread of the virus. So that's going to be done on an individual business basis. And I can tell you that a lot of our labor groups have offered plans up as well and suggestions, and there will be a minimum standard required.
Thank you, Joe. We'll come back to questions in the room, and we'll do a couple more in the room, and then a couple more.
Governor. You mentioned last time you talked about this, the need for a 14-day decline. We've seen an average in decline of cases recently, last 6 days or so. Can you say where we are in terms of that 14-day period on that timeline in terms of the dropping of cases?
We are making significant progress in some of the metrics that we're using as a result of Nevada's behavior. That's why it was very clear in saying I extended my order to May 15th, but I want to open prior to May 15th, if that's possible. If we can get all 17 counties to submit their information and their trajectory continues to go down, that's certainly something. Nobody wants to open up these businesses and try to get people back to work and back to their lives more than I do. And I'm hopeful that if we continue the trends that we're having now, and the LEAP committee gets this information to counties as it relates to their testing and tracing and capacities and whatnot, it'd be great to be able to do it before May 15th.
Gotcha. And in terms of that extension came down maybe 30 hours before the original one was supposed to expire. Can you talk about why that came so close to the expiration date of the first one?
Well, it gets to my communication with it. It would have been nice if I'd have had a press conference 3 days earlier. Some people were complaining that I did it then and didn't wait till today when I had all the local media in the room. But I didn't invite Good Morning America to this press conference, so that they weren't here for that. We've been working on that. We've been working on the directive. And would I like to give more notice? Yes. But I think there was, we did as quickly as I could, and we'll try to give you more notice in the future.
Okay, and last thing I just want to sneak in. Can you say where gyms, fitness centers, community pools, things like that fit into which phase those might fall under?
Which one are you talking about, gyms and fitness centers?
Yeah.
Gyms and fitness centers, and I've spoken to some of those individuals. Some of them have submitted plans to us. Some feel they can operate safer than others, practicing social distancing. Some of the smaller ones cannot practice social distancing, and they're saying, look, don't let the big ones open before you let the little ones open, because then we'll be out of business. We'll lose all our customers. You have to take that into account as well. We're going to work with our local counties to determine where they feel that ranks on the priority. But understand, any of these businesses that open are going to have to practice the same policies we've had in place as it relates to social distancing and hygiene and whatnot moving forward, and it'll depend on what kind of plan they come up with.
Thank you. We'll go back to the phone line. Jim Snyder, News 3, you're up.
Well, I did sign the decision, the directive yesterday, and if I'd have told Nevada first, I'd have had to call a press conference yesterday and then call another one today, and I didn't want to put everybody into 2 press conferences in 2 days. In an ideal world, as I said, I would like to have done it sooner. You know, we're watching our metrics very, very closely, and we came up with the plan, and we've been working for weeks on the plan to get our counties involved, because counties have asked for more input. I think it's fair that they get more input. I come from a local jurisdiction, and I know they know those areas, and we'll try to give you as much notice in the future as possible.
Thank you.
Thanks, Jim.
Governor, we know this virus doesn't respect state lines or county lines. Can you elaborate a little bit on how this plan hopes to address residents who maybe will go travel, have a second home, or maybe don't even live in that county but work in another county, right, and prevent that spread from maybe going to a county that can has the least resources and can't afford a hotspot?
That is, and that's a great question. That's exactly why we've come up with this plan, and everybody's going to move into phase 1 together. Some of the counties do not have any cases. They haven't had a fatality, and that's great, and I hope it stays that way. Unfortunately, if they get one or they get 2, it can overwhelm their entire healthcare system and the social tracing that's necessary, contact tracing. That's why we've got them putting a plan in place, so that if somebody travels from Douglas to White Pine and the virus travels right along with them, that both counties will have a capacity to deal with that situation and to handle any outbreak that might come as a result of that. The virus doesn't know state borders either. That's why we're collaborating with our neighboring states